Hey doctors, welcome back to MedMadness. Today we are diving into something that is not just for exam relevant, it's life relevant communication skills. These questions on step 1 are easy points if you know how to approach them. So let's talk about how to connect with patients, break bad news, or navigate those tricky conversations like a pro. Let's start at the beginning of any patient interaction, the interview. A great way to structure your approach is with a mnemonic IARVRF. I for introduce yourself. Use the patient's name and sit at eye level. Agenda setting helps figure out what the patient wants from the visit. Then comes reflection. You echo their concerns to show you are listening. So I for introduce, A for agenda setting, R for reflection. And then validation. Validation acknowledges their feelings. And then recapitulation. And this summarizes what has been said. And finally, facilitation. And this keeps the conversation going. Small prompts like go on or simple nod. It takes you a long way, right? Now building rapport. And this is where the magic happens. Remember the pearls. Partnership, empathy, apology, respect, legitimization, and support. If a patient is upset or anxious, don't ignore it. Acknowledge it, and that's where the trust starts. Now let's tackle one of the trickiest tasks, breaking bad news. You will want to follow the spikes protocol. SPIKES. S for setting, P for perception, I for invitation, K for knowledge, E for emotions, and S for strategy. First, set the setting, quiet room, no interruptions, and then gauge the patient's perception of a situation. And then ask for invitation to share information, and then share knowledge clearly, no jargon. Address the emotions with empathy, and finally, talk about a strategy moving forward. Let's talk inclusivity. First, when it comes to gender and sexuality, don't assume anything. Fine. Ask for preferred pronouns. Use terms like partner instead of husband or wife. And always maintain confidentiality. For cultural communication, try to understand where your patient is coming from. Ask how their background affects how they view their illness. That one question can open up a whole new level of understanding. Now, what about helping someone change behavior like quitting smoking or improving their diet? And that is where motivational interviewing comes in. The tone is non judgmental, remember that. Instead of telling them what to do, help them find their own reasons to change. Use open ended questions, affirmations, and summarize what they tell you. Then there is trauma informed care. Assume that many patients have experienced trauma and approach care in a way that avoids re traumatizing them. Ask permission before sensitive examinations. Avoid forceful or rushed interactions. When working with patients with disabilities, always speak directly to the patient, not their companion. Ask how they prefer to communicate, whether that's in writing, visually, or with more time. Respect their autonomy at every step. And don't forget about interpreters. If there is a language barrier, always use a trained medical interpreter and not a family member. Remember that. Look at the patient and not the interpreter. It builds trust and keeps the focus where it belongs. So, what should you take with you? Use IARVRF for patient interviews. Build trust with pearls. Deliver bad news with spikes and always stay patient centered. Good communication is not just polite, it is powerful. This part of the exam is much about who you are as what you know, and you are already showing up very strong. Let's keep going. Section 6 is up next. I am Dr. Ram here from MedMadness.